I got the screen to work. So again, I want to welcome you to this webinar on creating a systemic approach to ending homelessness. My name is Kay Mosher McDivitt. I'm a technical assistant specialist in the Center for Capacity Building at the National Alliance to End Homelessness. And it occurred to me that not everyone may be familiar with our organization. So the National Alliance to End Homelessness is a leading national voice on the issue of homelessness. We're a private, not-for-profit organization, and we work collaboratively with public, private, and nonprofit sectors to build state and community capacity that really leads to stronger programs that help the communities across the nation achieve the goal of ending homelessness. And then the Alliance's Center for Capacity Building that I work with helps communities replicate and customize best strategies that are cost-effective, they're data-driven, and trying to help communities that can implement these strategies at a scale that can significantly reduce homelessness on your community. So the system design clinics that we've done, and now this particular presentation, which is more of a short summary of the clinic, is really helping you as a community move forward in your goal to end homelessness. So for our agenda, I'm first going to give an overview of what a good crisis response system is and the background for the development of a crisis response system, and then I'm going to review the core elements of the crisis response system and touch on how you start the design, and then talk about retooling the transitional housing model to align with the crisis response system, and then we'll do the Q&A section of our agenda. So we're going to start by talking about the crisis response system as a whole and the background that leads up to it. So the most important focus for a best practice crisis response system is that programs and interventions in the community are driven by this housing first approach. And a lot of you may have heard a lot about Housing First over the last probably 15 years to really talk about it. And I talk to a lot of programs or a lot of communities that say they're Housing First, but then when you dig a little deeper, it's like, what does this really mean? And are we really a Housing First community? And have we developed a crisis response system that really embraces the focus of a crisis response system? So what it means is that the system is focused on helping individuals and families access and sustain rental housing as quickly as possible when the housing crisis occurs, and the housing is not time limited. So it's about moving quickly to permanent housing, and service participation is client-driven and voluntary, which is a real change for the models where, program eligibility and participation drove a lot about who we would accept and how long people would stay in our programs. This housing first approach that was first introduced probably 15 or so more years ago really turns that on its ear and starts saying that we got to start with the housing first. And once people are in their stable housing, a permanent housing place, not a temporary place, then we start working on all the stabilization and all the other stuff that we used to work on ahead of that. So the question then becomes, are you a housing first community, or are you a housing first provider? So here are the questions that any provider should be asking themselves, a funder should be asking about a provider they're funding or about their community, and community leaders should be asking when really looking at their system. So first of all, is our intervention permanent housing focused, where that focus on permanent housing starts at that front door? So the minute somebody walks in our door, we're working on moving them out of that door right away back into the community and permanent housing and out of our facility. Is rapid rehousing really rapid, or is it just some resources that are used after a period of time that somebody's in our shelter system or in our transitional housing, temporary housing system, and then after a period of time we use these resources to get them into permanent housing? Or is it rapid, where it is about the minute somebody becomes homeless, we are rapidly ending that homelessness and moving them back into permanent housing as immediate as we can? Housing interventions, this is a big one, are low demand, which means there's no eligibility requirements like drug testing or sobriety requirements, that we take people where they are, and then once they're stable or once they're in their housing, then we start working on all of those other issues. that people want, that traditionally programs have worked on. And then programs are going to be screening folks in and not screening out. And historically, and to give a little background, is that prior to being at the Alliance, I worked both at the programmatic level, where I actually ran a transitional housing program for a number of years, and then I worked for an organization that had a number of programs, including transitional housing, but we also had an intervention that was sort of a predecessor of the rapid rehousing approach. And it was sort of, we were running these two things simultaneously, and which was interesting because the one was very much not a housing-focused approach. In the transitional housing program, it was more program approach focused, and then we also had this other program that was really housing focused. But we had a lot of eligibility requirements about who could come into our programs, and they tended to be, more the lower barrier households that we were taking in. So this is the housing first approach is really turning that on its ear. And every intervention, and particularly permanent supportive housing, is actually targeted to those with the highest need. Those that are the most vulnerable and have the highest barriers are those that we should be serving first in a housing first approach. So I think a good place to start this discussion on the housing first approach is to really start looking at the national direction, and this really also drives a discussion on this, looking at a community systemic approach for ending homelessness and this crisis response system that we talked about. So there's two things that I'm going to talk a little bit about, is the HEARTH Act and the opening doors. So the HEARTH Act was passed in May of 2009. It was a legislation that reauthorized the McKinney-Vento Act, and it was signed into law on May of 2009. It sets the new direction for addressing homelessness, and there's a real focus now on performance. And I think the HEARTH Act has had a real significant impact on the development of an effective crisis response system, and is really directing funding towards those systemic approaches and interventions that have the largest impact on reducing and ending homelessness. And then the next thing that happened shortly after that, about a year after that, is that Opening Doors was introduced. It's the federal 10-year plan to end homelessness, and it was released in July of 2010, about a little over a year after the HEARTH Act was passed. And it brought together federal agencies that issued the nation's first comprehensive strategy to prevent and end homelessness. And Opening Doors actually serves as a roadmap for joint action by the 19 United States Interagency Council member agencies, and then also it joins with local and state partners in the public and private sectors. But it's like a larger plan that has, these focus and goals that local communities, local states, everyone can sort of be sharing the same systemic approach to ending homelessness. I think the thing that's most important to really recognize is that both the HEARTH Act and the Opening Doors plan were based on research that looked at the best practices of communities that were making significant progress in reducing homelessness. So it wasn't like somebody just decided they were going to come up with, some new strategy just to make, our lives more difficult. And it wasn't to say that, what we were doing in the past was not, the stuff that we were being asked to do, and we did those things well. But when communities that were willing to start thinking outside the box, it started trying new things like this rapid exit approach, and putting resources to housing people quickly. In Hennepin County, Minneapolis, they had a crisis with so many families becoming homeless, and they just didn't have enough shelter beds, which really drove shifting their approach in the late 90s to this rapid rehousing strategy. And suddenly their homeless numbers and their point-in-time count started coming down, and it was like these aha moments. And so HUD started taking a look and getting researchers to start taking a look at these communities and really learn from them, and then bring this back to everyone. And those interventions of best practices is really what has driven both the HEARTH Act and the Opening Doors plan. So let's talk just a little bit more about the HEARTH Act. So the HEARTH, and I know some people say, well, the title of the HEARTH Act doesn't matter, but I know when I worked in the local community at the continuum level, when we looked at what the what those letters stood for, it really helped us sort of set the direction and realize where we needed to have our focus. So HEARTH stands for the Homeless Emergency Assistance. Did I say that right? Assistance. the Homeless Emergency Assistance and Rapid Transition to Housing Act. So I think when you think about that, so what our system needs is we need to have, emergency assistance with rapid transition to permanent housing. So everything we look at in our systems, how does it align with that? Knowing that title can really clarify then what your crisis response should be. So, how do you address that immediate crisis with your emergency assistance, and then what are you going to need to reach that goal of rapidly rehousing every household who becomes homeless? So, we say this, that the HEARTH Act set the national direction for communities to use this systemic approach to preventing homelessness, because in addition to really focusing on performance, one of the other big things that changed with HEARTH was looking not at individual programs, but rather how the system as a whole is working. And I think the big thing that people know about, or maybe know about and don't want to think about because it's sort of scary, is this federal goal of ensuring that individuals and families who become homeless return to permanent housing within 30 days, which is a really, really big goal to reach. It's very challenging because in our homeless systems, we found that a lot of people have, frequently stayed in systems for, and homeless for well over a year or 2 years in some cases. In chronic homelessness, we see these repeat folks that repetitively come in and out of the homeless system. So this goal of the 30 days is really a lofty goal, but if you set your stakes high, then you can start reaching towards that goal and seeing where you can come and getting there. So I think when you look at what where we were before the HEARTH Act, that we would talk about our programs, and and we would focus just on what our program was doing, and we would talk about how we might interact with other programs, but everything that we talked about was very program focused, and programs sort of set their own goals and agenda of what they wanted to do, and programs were often developed around what an organization's needs or mission was, not so much what the community had identified as the main need. And then we really focused on activities. I know that, I used to report on how many life skills classes I provided and how many volunteer hours were provided at my organization, and how many nights of shelter I was providing and how many families I was serving. So, talked a lot about a lot of the stuff we were doing and really focused on these different activities, and we'd report out on that, and often got our funding in that way. I often got, some of my funding came in by how many of my beds were filled each night on a monthly basis, and that's how I would get my funding. And then we would really talk about, the shelter system, and that we would provide shelters, and we'd bring people into our shelters and people that were struggling. We would offer them a shelter from their life difficulties and bring them into our shelter system, and then give them services to, help them sort of get back on their feet again. And that getting back on the feet was this part of transitioning, where, people would eventually transition out, and we'd prepare them and get them ready to be self-sustaining and move into permanent housing. So how the HEARTH Act changed that is, instead of talking about programs, we are now talking about systems. And we need to look at how we operate as a system. And it's not about individual programs anymore. And in fact, it's not even about the programs setting their own outcomes. It's about the system as a whole. The entire in the System Design Clinic, that the common agenda is that homelessness will be rare, short-lived, and non-recurring. And when you come together with a common agenda, every program, every organization in the community, every fund in the community starts looking at how does this fit with our systemic approach to preventing and ending homelessness. And instead of just activities, and this really hit me when I was a provider, and I was sitting at actually a United Way funding presentation, a community panel, and was talking about all of these great things that my program was doing, and these, all these great families we served, and all these, activities that we were providing. And somebody said, well, but so what? What, how is it making a difference? And I said, well, the families' lives are just so much better. And they said, well, give me some specifics. And that was the first day that I started really saying, this program is supposed to be about ending homelessness and moving people into permanent housing. And having that one person ask me that question made me completely shift my thinking and what that program was providing and how it was adding to our community systems approach to quickly ending homelessness, and we completely changed what we did, and we focused on exactly one outcome, and that outcome was moving people into housing. And then we actually started providing the housing stabilization services after they moved into the housing. But it really is focused on these outcomes, so what are the outcomes if homelessness is going to be rare and short-lived and non-recurring? What should our outcomes look like? And then instead of, having shelter beds and when a bed's available and a family fits our criteria, we bring them in. It's really this focus on closing that front door and getting the prevention resources at that point where people really are calling because they feel like they don't have any other place to go and they need to come into the shelter system. And frequently those families are doubled up, but most times those families can be prevented and diverted if we have the right resources and the right strategies at the front door. So this focus on keeping people out of the system and reducing the numbers of people coming in. And then the last one, instead of this transitioning and getting people ready to move, back into the community, the idea is that, it's the right thing to get people back in the community quickly, rapidly, and then help them get the services they need once they're in their own homes, rather than having them live in temporary short-term facilities and then having to still move out and, and go through getting those services all over again. So there's 6 objectives that are really important in knowing about the HEARTH Act, and I'm going to go through this. I think, again, it's really critical that not only the homeless service providers in the community, but also community leaders and all the stakeholders know what these objectives are, because these objectives are now being looked at from a systemic point of view. So if there's 1 or even 2 programs, a couple of programs in the community that are not aligning with these or really looking at these objectives, it can really impact the rest of the community. And what can happen is that the system, the homeless response system, is going to have poor outcomes in meeting its goals, which can really impact the local Continuum of Care's ability to leverage federal or state dollars to support other interventions. So it really becomes a systemic look at this. So here are these objectives. So remember I said homelessness should be rare, short-lived, and non-recurring. So look at number 1, rare. We reduce the number of people who become homeless. How do we make homelessness rare in our communities? It's by this front door strategies of reducing the number of people who actually become homeless. And then how do we make homelessness short-lived? We really focus on strategies that reduce the length of time that people are in our system. What is it that we need to do, and where do our resources need to go to help people exit our system quickly? And then the third one, and non-recurring. Homelessness should be non-recurring. We need to reduce the returns to homelessness. What we know is that historically there were certain populations that would sort of just, like a rotating door in and out of the homeless system. We'd see, maybe 20% of the homeless population, that we would spend a lot of time and resources on, and they go through programs and get housed, and a couple years later they'd come back into the system again. So what do we need to do to make sure that that doesn't continue to happen? And then the fourth one has actually was not, the first 3 were the new ones that are really driven by the HEARTH Act. The fourth one, McKinney Continuum of Care dollars have always looked at the increase in jobs and income, but that continues. But I think the other 2 are really important, and one is that, everything, I think communities were often measuring a lot of other stuff, and they wanted to keep doing that, and HUD's like, saying that's great. The main thing is it reducing your homelessness? I mean, everything you're doing should be about reducing homelessness. So, keep focusing on all the other things that you need to do that will help you reduce homelessness. And the last one, I think there was a lot of concern from folks initially that, if we're going to reduce the number of people who become homeless or reduce the length of stay, then what programs will do is they'll just start screening people out, and just take in, not taking the difficult people to serve that are going to end up staying in the system longer. And so communities also have to measure and show that they are thorough and they're actually reaching the most vulnerable, hard-to-serve homeless populations, and aren't screening those populations out. So your crisis response system really needs to have the interventions that impact on those 3 first steps that I talked about, the new entries of repeat episodes and longer episodes. So first, to reduce new entries, you really need to target your prevention and diversion dollars at the front door of shelter. So, when someone has, literally, they have no one else to stay with, and if they don't get sheltered that night, they're calling in because they need the bed that night. They can't stay where they are anymore. where are there some prevention and diversion resources that could be used? Because sometimes people feel that way, but with good mediation, with some intervention, you know, sometimes those doubled up, and actually we're finding in many cases those doubled up situations can be really made to be successful interventions for families, and can be very successful when there's resources and some mediation that's put there to make that situation work out. And so how are we using our prevention resources? Are we using them at the front door? Or are we, you know, using them when people maybe just have an eviction notice and there's really no indication that they're actually ever going to enter the homeless system? You know, we need to know what our data looks like, who's most likely to enter the homeless system. And in fact, we know it's people that are living with family and friends are most likely to enter the homeless system. We know that people with repeat episodes of homelessness or former episodes of homelessness are more likely to come into the, homeless system again. And looking at your data from who do you currently serve in your homeless system, what are the income levels, and those are the folks that you need to be using your prevention diversion resources. So having, really robust prevention diversion sources at that front door. And then if you want to reduce your repeat episodes, you really need to look at permanent supportive housing and follow-up case management services and prevention resources. Again, targeting those resources to those vulnerable populations that are most likely to re-enter the homeless system. So again, using your data. When we have recidivism, when we've seen households that come back to the system, what do they look like? And so if in fact somebody's had a prior episode of homelessness, we've heard that there's communities that won't give prevention dollars to somebody that's been rapidly rehoused with rapid rehousing dollars. If, 6 months or a year later they get into trouble, they're not given those dollars because it's sort of like, well, you got the assistance, so, if you couldn't make it, we're not going to help you. But in fact, it would make a lot of sense to use your dollars, your prevention dollars, towards those households, because we know that one of the highest indicators of a repeat episode of homelessness is having been homeless before versus somebody who's never been homeless and is in the exact same situation. So really looking at your data and making every decision be very data-driven rather than sort of anecdotal or thinking what we sort of perceive as the best way to do it. Are we really making data-driven decisions about how we use our permanent supportive housing, how we do follow-up stabilization case management, and how we do our prevention resources? And then obviously longer episodes, finally rapid rehousing interventions at the start of the homeless episode to quickly rehouse those households is the most significant way to reduce the length of homelessness in your community. So if you look at this, we're already sort of setting the stage for what are the interventions that you need to have in your crisis response system. So the opening doors, again, the federal strategic plan, how does that give you direction and creating your systemic response? So one of the 10 objectives of the opening doors is, I think it's actually listed as number 10, and it's to retool the homeless response system by transforming homeless services to crisis response systems that prevent homelessness and rapidly return people who experience homelessness to stable housing. So again, that's what your system, that's what your homeless response system, and there's where you first start hearing that term, crisis response system, which is the term we're using when you design your crisis response system. It's really about looking at, how do we prevent homelessness and rapidly return people who experience homelessness to stable housing. So there's 4 targeted goals set forth in the Opening Doors plan, and one of the reasons it's important, and I talked about when the plan was introduced in July of 2010, and the reason that's important is that these goals were implemented in 5- and 10-year increments. So the first 2 were finish a job ending chronic homelessness and preventing and ending homelessness among veterans, both of them in 5 years, which is 2015. So there's this real push right now, let's talk specifically about the veteran homelessness. There's this real push right now to, at the 2016 count that you do in January to really get those homeless numbers among veterans down to 0. And the VA has really put a huge amount of funding towards this effort through, some VASH vouchers, but specifically towards the SSVF program, which is Supportive Services for Veteran Families, which is targeted prevention and rapid rehousing resources specifically for veteran families. So I think for both of these, communities really, and communities and programs within the communities really need to look at how are you contributing to these goals, because both of these are to be completed in, we have like, a year and a half to get towards both of these goals. And so do we have the right resources in our community? Are we funding those programs that are really focused and directed on these goals? And then the third and fourth goals are the preventing and ending family homelessness, and also around children and youth in 10 years, and then ending all homelessness in 10 years. So what does it need? We look at these two smaller populations, which is the chronic and the veteran homelessness, and then but then we still need to keep working on these other ones, and we know that chronic homelessness can cost our system a lot more money, and if we can really work to end chronic homelessness and then, have interventions in place where people don't have long stays in homelessness, we can reduce some of our costs and have more dollars to really work on these longer-term strategies to prevent and end homelessness among families and all homelessness. I think the one thing that's important to know is that, Sam is on this call, and she can certainly jump in because she's the director of our Homeless Research Institute, so she's going to have this more specifically than I do. But when we do see the point-in-time count, I think that persons and families make up for about a third of all homeless persons across the nation. And then, so singles make up the balance. So the largest population that's homeless in most communities, and we saw this across the state of Virginia when we were doing our system design clinics, is that single non-chronic adults is the largest homeless population, and families represent the smallest amount, and yet many times there's a ton more programs for families than there are for the single non-chronic homeless population. So again, it's one of those things to really be looking at and right-sizing your system. So then I also want to talk about HUD set out 7 priorities, and as I go through these, you're going to see some real connection with these 4 federal, and again, the Opening Doors is not a HUD plan. That is a federal plan that's been supported by, and I can't say all of them, but many branches of the federal government were involved in the development of the plan, like Labor and Industry, Health and Human Services, the VA, the Veterans Administration, and several others. So the Opening Doors plan is across all offices, not just the HUD department. But then what HUD has done with their funding is really develop their priorities around the goals in the Opening Door plan. So the first goal is to have a strategic resource allocation that really looks at where our resources go, and really looking at, do the projects in our system give us what we need, and are we using our resources to fund the projects that we really should have and the right interventions in our system. And then here we go, ending chronic homelessness. We need to increase permanent beds for chronically homeless folks. We need to give priority for our existing permanent supportive housing beds to those that are truly chronically homeless. And also, again, permanent supportive housing needs to be offered under the housing first condition or housing first model with no preconditions such as sobriety or required service participation. And then we need to end family homelessness. And this increase in rapid rehousing is a strategy to really start ending family homelessness. And under the HUD priorities, they talked a lot about starting to really reallocate existing supportive service only and transitional housing projects to rapid rehousing. And I think another thing then that becomes very important, so number 2 and 3 certainly go with what I just read on the Opening Doors. But then when you look at all of this is, systems really need to be looking at removing the barriers to all the interventions, all the programs in their system. So every system and then every project level criteria really needs to be reviewed to remove those barriers to accessing services. Again, are we screening out rather than screening in? And one of the ways to make sure that that happens is by using a really good centralized coordinated assessment system. And one of the things under this particular priority that was in the NOFA last year is that, and this language comes right out of that, is that Continuums of Care were encouraged to review their transitional housing models to determine if rapid rehousing may be a better model. And I knew I saw a typo on the slide, and there it is. So we'll get that corrected. And then the fourth one is making sure we use mainstream resources to pay for a lot of the services, like HUD funding can be used for housing-related costs, but how do we start really working with partners in our community to pay for some of the services, because there's not enough dollars from HUD to pay for the housing and all the services. And it talks here about some of those ideas that you can think about. And there were two partnerships that HUD really talked about being important that continuums and communities should build, and one is to really engage the Public Housing Authority to create homeless preferences or adopt strategies that would help those those experiencing homelessness to access those precious few vouchers that are there. Again, prioritizing the most vulnerable populations, for the limited resources. And the second one, which is really important, is engaging the philanthropic organizations to maximize and increase resources towards ending homelessness. In other words, this is more than just some federal money and state money. If we're going to end homelessness, we all have to have one strategy, one way of looking at our resources, and a systemic approach where all the funders know, what is important to fund, and we have a good plan for how the money is being spent in our community, and we engage other funding partners in that. And then making sure that we're working well with the veteran system and the homeless youth. There should not be three separate continuums, one for veteran homelessness, one around youth homelessness, and one around general homelessness. It's all homelessness, and we need to make sure that we have one continuum that's coordinating and working together on all of this. So now that I've covered the national direction, I want to look at a little bit on that first priority that I reviewed. So every community really needs to develop a resource allocation plan based on best practices, the necessary interventions, and right-size your local system. So one of the things that should happen is that programs really should be evaluated based on, are they meeting the HEARTH objectives and the goal of quickly ending homelessness. But again, this is not just about HUD dollars. It's really important to know what interventions are costing communities, and if all resources, including private donor dollars, foundations like the United Way and businesses, are those dollars also supporting the most cost-effective strategies that are making the biggest impact? So creating a resource allocation plan and determining how much of those resources are going to the right intervention is really going to be important in designing your system. Sort of like, okay, here's our pie. Here's all the funding that supports homeless services in our community, and how are we slicing up our pie? And are the slices, the largest slices, going to those interventions that have the largest impact or the most cost-effective? So just briefly, before I go on to the core components, I want to note some of the changes that have been implemented with HUD funding. And what we found is in many cases, states have utilized similar criteria for their own state funds. So under emergency solutions grants, at least 40% of the funding now has to be used for prevention and rapid rehousing services, although HUD is really emphasizing and encouraging communities to use all of those dollars for rapid rehousing if possible. But in fact, you can use more than 40% of emergency solutions grant money towards prevention and rapid rehousing services, and a lot of communities have done even more like a 70-30%, with 30% going to shelter operations and the other 70% going towards rapid rehousing and prevention. It's also, one of the things is everything needs to be coordinated with a continuum of care, so there's not like a separate funding strategy for emergency solutions grants and a funding strategy for continuum of care. That, again, having a resource allocation plan, everybody uses that plan regardless of where dollars come from. And some of the changes under Continuum of Care, there's a real shift away from supportive service only and transitional housing projects to permanent solutions like permanent supportive housing and rapid rehousing projects. And in fact, rapid rehousing projects are being funded for the first time under Continuum of Care. They were never eligible prior to last year, 2 years ago. And again, I talked about this before, that continuums are encouraged to reallocate from poor performing strategies to rapid rehousing for literally homeless families and permanent supportive housing for the chronically homeless. And also it establishes that there should be a governance structure that is responsible for establishing eligibility and priorities for all interventions. So it's more about a system, and it's less program ownership and more system driven. So one of the things I often talk about is that, what we have really do well in our communities is that, we're a lot of clocks. that all come together in one clock shop, and we work really well together. We're emergency shelter programs and transitional housing programs and rapid rehousing programs, and some supportive service programs and permanent supportive housing programs. And we sit around the table, we talk to each other, we cooperate with each other, and I say we often keep time together pretty well, like, we chime at the same time. But the systemic approach changes that approach because we're still operating as separate clocks. We all are unique. We all have our own policies and procedures and our eligibility standards, and we set our own performance measures and sort of do our own thing within this clock shop. And what we really need to do is build a clock where each of you, each provider, each intervention is a gear in that clock. And if one gear is out of sync, the entire clock stops working. And so, how do we create this one clock, and how do we make sure that our programs are working together? And it really takes a lot of work to include all homeless service providers. This, again, is not just about federally funded providers. It includes faith-based providers. It includes all the non-federal providers. How do we really build this system? So let me talk now a little bit about the core strategies as we go through this. And, I'm aware that we're going through some time, so I may go through some of these slides more quickly to make sure that you have time for questions. So, what does a good crisis response system look like? So this is, sort of a summary of some of the stuff I talked about, but as we go into these core interventions, the goal, again, is to prevent and end homelessness as quickly as possible. You make sure that you allocate your resources to the most effective and cost-efficient strategies that quickly rehouse households. That conversation about rehousing begins as soon as the household becomes homeless. The system then also targets the services effectively to those with the highest barriers instead of the lowest people getting into the lowest barrier people getting into programs. It's really those that often have been screened out are the ones that we're going to start really making sure get the services. It really empowers the consumer and consumer choice. It's not, mandatory services anymore, but rather what the consumer identifies as what they need to end their homelessness. And then it uses practices backed up by data and research. So here's the 4 necessary interventions in a crisis response system. You need to have a coordinated assessment that includes diversion and targeted prevention at that front door. You need to have crisis response housing with crisis services. You need to have rapid rehousing, and you need to have permanent supportive housing. Those are the 4 necessary strategies. So quick definition of coordinated assessment. It's a process that matches and prioritizes consumers for the different interventions, that uses standardized tools that are not subjective, and it has a referral process, and there's no side doors. It's that every program in the community goes through this sort of channel, so to speak, where everyone, no matter who you are, when you become homeless, you have a subjective assessment that's going to help you get the intervention that best fits your needs, that can quickly get you out of the system and rehoused. And it's based on a systemic perspective. It's not about the program that's running the coordinated assessment. It's really, in fact, the governance standards say that the continuum is responsible for operating the coordinated assessment. So, it's systemic standards for eligibility and prioritization for each intervention. So, it's not about each organization have its own eligibility standards. It's about how do we make sure that everything looks the same regardless of where people are going to, that they're getting the same types of services that they need. And it prioritizes clients for different interventions and those with the highest needs, so it's no longer that first come, first serve process. It integrates information into the HMIS system so that we can tell if it's working or not. If we don't have good data, we don't know if things are working well. And I'll say when done right and done well, it really lends itself to big systems change. It really does close that front door to homelessness because it closed all the side doors to shelter and transitional housing and really does a good job of diverting and preventing whenever possible. So the assessment tool is tiered. So I think one of the things that's really important is that everyone, what often happens is that in this coordinated assessment process, everybody gets this really deep needs assessment Everybody gets it. And the reality, there's only a few people that come into your system that really need that. Because what we know is that a lot of people could be prevented and diverted with a much shorter questions and review process, and then connected with the right services. So, instead of wasting your time and resources on, doing this intensive assessment with every single person that calls in, you start with this basic prevention and diversion screening. And what we're finding is that in communities, right here we're saying it's about 25% can be diverted and prevented, but the longer we are working with communities and hear from people, we're seeing communities that are doing as much as 40–45% prevention and diversion and doing it well. But say it's, we start out with everybody, so about 75% of the people will come in and get a shelter bed. But even out of that 75% that comes in, what can happen is in the first couple of days of coming into the shelter system that, in fact, many people will exit on their own. But if people aren't exiting on their own and figuring out, within 3 to 4 days, you might want to start doing the more of a housing barrier assessment, which is just going to look at the barriers to housing. These are not self-sufficiency barriers, but rather the things that a landlord wants to know, like your credit history and your criminal record. And then then after that, then you're going to find that there's going to be some of those people with a high vulnerability that are going to maybe need a deeper intervention, but only about 25% of those folks that get the housing barrier assessment are actually going to need the vulnerability assessment, that deep needs assessment. So I think, again, just remembering to do what actually you need to do and not to overassess is really important. Again, the factors that focus on the housing barrier, the things that you really want to do and look at, are going to be the things like the criminal history, the credit history, the rental history, and the family size. And again, remembering that most of the people that come into get a shelter bed will only need a housing barrier assessment to be rehoused and won't need that higher vulnerability index screening. So again, just reminding you not to overassess. So the next key intervention is to have crisis housing and crisis services. Again, the definition is temporary short-term housing to alleviate a consumer's immediate housing crisis, which is a first step to be rehoused. And it includes street outreach, emergency health, and crisis services. It's those crisis services. Somebody comes in with a medical need or a mental health need, and there's a crisis. In addition to the crisis housing, you want to meet that immediate crisis need, but then the focus starts on the housing, all those deeper needs that need to be met, and all those other resources that we tend to start engaging people in right away. We work on the housing first and then engage them in all those other services once the crisis needs are met. And here's the best practice, is that emergency housing, your emergency shelter, crisis housing, needs to have strong links to permanent housing. In other words, it's, instead of from emergency shelter to someplace else, it should be an emergency crisis housing directly to permanent housing very quickly. They need to be, all emergency crisis housing needs to be low barrier with a housing first approach, and it needs to be accessible 24/7. Not, we see a lot of crisis housing, emergency shelter where folks can come in and get a bed at night, but they have to leave during the day. And getting this links to permanent housing and ending homelessness quickly is just not going to help and work if you don't have a place to be, and it's not a 24/7 facility. Strong links to coordinated assessment. Again, no side doors. That we do the screening through the coordinated assessment first for prevention diversion, and then assign that shelter bed. And also that strong linkage to the street outreach to make sure that the most vulnerable are getting linked to the crisis housing. And then the third is rapid rehousing. So you want a robust rapid rehousing intervention, which is a permanent housing intervention that returns households to permanent housing quickly through the use of temporary rental assistance, voluntary home-based case management, and connection to mainstream resources. Again, systemic. This is a systemic perspective. So a community needs robust, rapid rehousing interventions, and it's probably the thing that very few communities have enough of. What we hear so often is that there's, one funding source, or, an organization gets X amount of dollars, and they, house X amount of families that money can support, and then they stop doing rapid rehousing until the next source of funding comes, and that is not rapid rehousing, and that's not an intervention. Just like you don't, close down a shelter after the funding runs out after 3 months, and you just close it down. You don't do any emergency shelter for the next, till the next year of funding comes, or the transition housing program, or any other services. Rapid rehousing intervention needs to be looked at the same way. So what is it that we need to really support the amount of rapid rehousing we need in our community? So really think of rapid rehousing as a major component of our crisis response system, not just a program. And again, system-wide policies and procedures. If there are some communities that have one organization that does the entire rapid rehousing intervention, which makes it much more of a systemic policy and procedures, but there's other communities that may have 3 or 4 organizations that are providing rapid rehousing. And again, making sure that you do it in the most cost-effective way in terms of overhead and administrative costs, but also making sure that every program is run exactly the same. One of the things the Alliance offers is a rapid rehousing certification that has certification standards, which really leads to organizations that meet those standards having similar policies and procedures to all other best practice programs. And you use a progressive engagement approach, which really is about not deciding who and who cannot be rapidly rehoused from the front door, but starting everybody with the same, sort of this minimum amount of assistance. So instead of starting out with a lot and then reducing it, it's more about starting out with a little, and then a lot of people can figure out how to make it on their own, and others may need a little bit more, but it's really hard for us to figure that out first. So you provide more resources as you're able to see the people that may need it, but you start out everyone with just a little bit. And it really is focused on short-term shallow subsidies that are very much individualized to client need. It is not a one-size-fits-all package, and it's, a good rapid rehousing strategy across the system is that, it's about helping each household meet their, meet what they need individually and with the least amount of assistance that we will give them, because dependency creates dependency, and if it looks like Section 8, it feels like Section 8, people start thinking that that's what they're getting, and then it's really hard for them to move out of that mode that this is something they need to sustain on their own. And finally, and you've heard me say this, that in the best practice, rapid rehousing intervention is rapid. It's connected with crisis housing, not longer transitional housing, because again, if it's not at that front door, we have set the standard in our rapid rehousing certification that that the average length of time between shelter entry, and that's the homeless system entry, to exit is 45 days to be a best practice rapid rehousing program. And then finally, permanent supportive housing, and I think this is probably the definition is more familiar to folks perhaps, and permanent supportive housing is housing units which are scattered site or congregate, often with housing vouchers, and then there's intensive wraparound services that successfully house a community's most vulnerable population, prioritizing the chronically homeless, and it's a housing first approach. So again, the best practice systems perspective is that I just said this, it needs to house the most vulnerable, low demand housing. People don't have to be clean and sober to move into the housing. And there's systemic wide policies and procedures, so that even if there's 5 or 6 or way more than that programs in one community, they all use the same policies and procedures. And again, really looking at thoughtful, consistent targeting and prioritization criteria, so making sure that the most vulnerable are being housed. So just a little bit on how you design your system. So this comes from the United States Interagency Council paper called What is Crisis Response? And directly from that, what the paper said is while many providers across the country have adopted rapid rehousing and housing first models, it is our ability to take the concept to scale nationally that will ultimately determine our success at ending homelessness. It's not enough for a few providers in each community to have adopted this approach. We need entire communities to embrace the philosophy and restructure their systems. The old model was emergency shelter, transitional housing, and permanent housing. The new model is based on access. So, that point of access, getting the right assessment, which we talked about, and then getting the assignment of intervention that's going to rapidly rehouse you. So when you're restructuring to a crisis response system, one too many, so there's sort of 5 basic steps that we really encourage you to do is, really, again, knowing what your data says. Who are the homeless in our community? How many families do we have? How many singles do we have? What are the kinds of needs that they have? So how do we make sure that we have the right services and the right amount of services necessary for each one? And then define what and how much of each intervention is necessary to meet those needs. And so again, when I showed you that USICH model, you saw like, each of those blue sections of the diagram were sort of the size of what the intervention needs to be. And yet when we look at communities, often we see that there's, a ton more of certain strategies. There's, often the rapid rehousing piece is like so minuscule you can barely see it. And then there's a lot more perhaps transitional housing or even crisis housing than what's needed, because if you'd have enough rapid rehousing, then you wouldn't get backed up in the crisis system. And then again, determining how your resources are being used to implement those strategies to best meet the needs in the system. So then what's really important is to set these systemic benchmarks for everyone in the system, and they get analyzed regularly, like quarterly, pulling those and doing some analysis, and also continuing to look at your population and looking at your data. We do a lot of collecting numbers. We do the point in time count. We do inventory surveys. We often will do some client surveys, but we get lots of stuff, but often we don't really use it. At our conference this summer, Kelly King Horn with Homeward in Richmond, Virginia said, we love data at Homeward. We love collecting it. We love looking at it. And finally, we realized we had to actually start doing something with it and start analyzing it and making some different changes. And through, they're looking at it, they are really doing a lot of work around redesigning their system. So again, just to remind you, the 4 interventions would be coordinated assessment that includes diversion and targeted prevention, crisis housing and services, rapid rehousing, and permanent supportive housing. So again, asking the questions, what does our system look like and what do we need to do to move forward? So here is, and I was actually thinking that maybe I showed this to you before, but I didn't. But this is the USICH model for a crisis response system that they put together. And I think, when you look at this, again, this is looking at the types of interventions that you need. So everything starts at this coordinated assessment. And this was specifically designed as a framework for families. And so, you can see that, again, they use that model that about 25 to 30% are targeted, have targeted prevention diversion. So, that should be, though, do we have that much of a robust program? Are our resources going so that we can do that? Because that's what we may need more resources there to really do a better job. And then we have this temporary shelter. But we find that a lot of people will exit on their own and go, directly into this community-based housing. And again, the green section is all community stuff. No fund, not the funding from the HUD system that goes into there. That's where a lot of people will go. But the majority of people from the temporary shelter are going to go to rapid rehousing. I mean, you should go to rapid rehousing, but you need to have a robust rapid rehousing program to make that happen. And then you have the permanent supportive housing here, which is for the most vulnerable. Those families with the highest needs would go directly to permanent supportive housing from the coordinated assessment or from the crisis stabilization housing. So I think the thing here is that, there was a lot of discussion about whether to include transitional housing on this model, and the decision was made to include it there, but as you can see, it's the smallest intervention that's on this model. Because in essence, what studies have shown and what research has shown is that the majority of people don't need transitional housing intervention, and in fact, in fact, it's probably one of the most expensive interventions, and what we do when we look at sort of this, where your monies are being spent, we have seen communities where transitional housing beds may only make up 20% of their entire inventory of interventions, and yet it may take up as much as 2/3 of the funding because it's so service rich and staff rich. And families stay for such a long time that the cost per household served is significantly higher than others. So we're going to talk a little bit about what we know about retooling transitional housing models. So one of the things that happens at the Alliance is that we often hear from communities and providers that are successfully retooling their programs, and communities are seeing significant results, which includes it includes seeing increased exits to permanent housing, and then short length of stays, and by retooling transitional housing have really seen their system increase their capacity of how many people that they can serve. Okay, and so we've also learned a lot about transitional housing length of stays and outcomes. So one of the things that we know, and one of the reasons that transitional housing has cost as much as it has, is that the length of stay can be up to 2 years. We do see quite a range of stays. Some are shorter stays, and others still go up to the 2 years. But nonetheless, it still can create a backlog in the system, and because once you don't have that rapid movement from one piece of the system to another. So for example, on the slide I showed you a few minutes ago with the USICH crisis response, is that if that there's very little movement out of permanent supportive housing. So, once somebody gets in there, if there's not movement in other places in the system, what can happen is that block of crisis housing, there's, people stay in that crisis housing longer because people are staying in transitional housing longer, and people aren't moving, out of permanent supportive housing once they've stabilized into maybe, another permanent housing intervention. And it's permanent, they can stay there permanently, but do they need those intensive services? So the system constantly has to be looking for how do we get movement so that we can, because people will continue to have housing crises, and we have to have a place for those, that we aren't able to prevent and divert, to have a place to stay while we're getting them rehoused very quickly. So again, by reducing the length of time people are homeless, and by really looking at the interventions that have longer stays, and trying to change those interventions, we find that we can really make a difference in our system at a much reduced cost. So for example, I took this actually from Fredericksburg to sort of give it a sense of when we talk about the length of stay. This is the data for Fredericksburg, Virginia for the last 3 years for the entire year. It pulled how long people, the average length of time that people were in shelter, emergency shelter, the length of stay in all of your emergency shelters, and then in transitional housing. And so even in your emergency shelter system, remember we talked about that the goal is 30 days, but in your system that most people are staying about 3 months, close to 3 months, and then in fact, it doesn't taper off to the bottom, so there's people that are even staying up to 6 to 9 months. And so, well past the 30 days. So if we meet the HUD goal, and your most recent line is the dark line here, is that's last year's data for everybody that was in your system last year. But if we'd really meet the goal, it really should be 30 days, and then we should have this drop off at 30 days. Now let's compare that to your transitional housing, and this was for families because you don't have transitional housing for singles that was reported in your HMIS. And so again, when we look at the dark line, we can see that the length of stay are significantly longer, and we don't have those sharp drop-offs. Now the good thing I'm going to say in this is that there has been improvement in the length of time, shortening the length of time for transitional housing, that at 9 months, it started coming down, but it's still, there's still people that are there more than a year. And so when you look at that length of stay, one thing it does is that, it takes away from the HEARTH objectives. But then the second thing that happens is that also the longer people are in the system, the more it's costing us to serve that family. And then it takes up resources. We're spending tons of money on, one family, and and instead we could perhaps be using those dollars to serve more families, which would then help our system move more quickly. And if you have questions about that, please ask, because I'm going through this sort of quickly. So one of the things that we've talked about, we do these clinics, and we've taken some data from a number of communities where we've conducted the clinics, and this was local community data. So these next three slides, I'm going to share some of this data. This first slide shows aggregate data for families exiting different systems with permanent housing in 14 communities across the country. So data, these communities all had very good data in essence, that they had almost every provider in their system entering data in real time. And so, and one of the other reasons we use communities is that they represented like a a vast geographic area. These include high-cost housing, urban areas, rural areas. There were some balance of states in this, and there were both large and small continuums. So as you can see from here, this is for families. So the percent of exits of all the people that exited shelter in this given year, which was like, yeah, between 2011 to 2012, all the families that had exited shelter that year, only 32% of them had exited shelter and moved to permanent housing. Out of all the transitional housing providers, and again, remember this is systemic, so there could be providers in this that have much higher data, but then there's providers that have low data, and it doesn't matter what an individual provider is doing anymore. It's what your system's doing. So we only saw a 55% rate of everybody that entered the program, not those that successfully completed our programs, but everybody that entered our doors. How many of those exited to permanent housing? It was 55% in transitional housing, and in rapid rehousing, it was significantly higher, 85%. And these are when these exits are measured when people are exiting the program. So at rapid rehousing, this is not when they moved to permanent housing. This was measured when they exited the rapid rehousing program. In other words, all of their financial assistance, they were no longer getting any rental subsidies, and they were no longer getting case management services. At the point where they got absolutely no assistance anymore, 85% were still in rapid rehousing. So then the question always comes, well, yeah, but maybe more people go to go to housing, but what about coming back into the system? So here's the returns, the recidivism rates for those very same communities. And so what we found, and these are singles, and so in singles we did see that a few more singles returned to shelter, or to return to homelessness that were rapidly rehoused versus those that came from transitional housing. But what I didn't show you is that what we know is about twice as many singles exited into permanent housing. So there were a ton more people that had exited to permanent housing, rapid rehousing, than they were here. So the raw numbers, this 9% still represented a lot less people than what this 7% did of the total that had left. And then in families serving children, and this for whatever reason we see this tends to often be the same, and we think perhaps this is because more of the singles have maybe deeper barriers, housing barriers, and that's one of the reasons there's a little higher rate of return. But with families with children across the board, rapid rehousing has significantly lower return rates. And again, this was measured a year after they were exited from the rapid rehousing program. So they had gone a year without any services, any financial or case management services at all. And yet in transitional housing, not that high, only 9% return, but again, those are people that had been exited, had been given, in-depth long-term services, were exited permanent housing, and still 9% of those, even after all of those services, were returning to housing, where rapid rehousing, which gives a lot less intervention, had a lower return rate. And then I think more significantly is this average cost per intervention. And this held true when we did this in Virginia. Again, we saw a very similar thing holding true. In fact, we saw transitional housing costs for families that was even higher than this. But usually the cost of transitional housing in communities per permanent housing exit, and this is looking at the entire program cost to operate the program, and this also is looking not just at the financial assistance, this is looking at case management, staff, administrative support, overhead costs, all the stuff that goes into a budget. This included, from these communities, included the entire cost to run the rapid rehousing program, not just the financial assistance, as did this. They were compared apples to apples. So we find that in most communities, the cost of rapid rehousing is about anywhere from 20 to 25% of that of transitional housing, and usually about half the cost of emergency shelter. So why retool then? So when you really think about retooling, it really is an opportunity that really helps you look at, is your program contributing toward the performance objectives? And I think, again, retooling is going to allow communities to take a close look at programs and to really assess their effectiveness. So, transitional housing really has rich resources that can really be used to reduce homelessness, and how do we really look at those resources from a larger systemic approach? So if you're thinking about retooling, like how do you first get started? So I think there's sort of two issues that you should really think about. First is you need to work with your local continuum of care to figure out what you should be doing with your resources, because again, needs to be a systemic approach. What does your system need? You know, we've seen communities where, you know, provider says, well, we're just going to become permanent supportive housing for families, only there's no chronically homeless families in that community. So that really is not a good option for that particular system. That's not going to contribute to a systemic response. So first, it really needs to be the system saying this is what we need and working with a provider to figure out what to do next. And then figure out what steps you're going to take to determine that model and who's going to be part of that planning process. So when you look at retooling with Continuum of Care Fund, you can and in fact are encouraged to reallocate to, there's another phone ringing in my office, to another housing, a permanent housing model. You're really encouraged to look at that and that aligns with your continuum needs. So for programs that may, you know, really have a commitment to serving families, then it's really recommended that you would look at rapid rehousing only, because most communities have very few chronically homeless families that need permanent supportive housing, and we also know that most communities don't have sufficient resources, rapid rehousing resources. So that would really be a good use of that. I think two things to really think about is, you know, how you use your building. There's a lot of ways that people have done that, and realize, again, that continuum of care funding can only be used for families living in emergency shelter beds, people that are literally homeless. And then with permanent supportive housing, it's only for those that are chronically homeless, families and individuals. So it's not for high-need families, but rather those that meet the definition of chronically homeless. So just a quick case example, Flagler Home at St. Joseph Villa in Richmond. Their original model was called Flagler House. Actually, I think it was called Flagler Home. It was a facility-based 2-year program. It was established in 1987 for single mothers and their children, and sort of like what Lisa said, had like wonderful outcomes, was just a well-respected program, had won many awards for the work that they had done in transitional housing. But when they started really looking at it, because most of their families stayed well over a year into 2 years over that, you know, 18-month to 2-year period, the average cost for serving a family during that period of time was about $45,000. So today, they're now Flagler Housing Services. They closed their doors to Flagler Home in July of 2013 and have become a completely rapid rehousing only program. They closed the building down and are looking at repurposing the building. And their cost per household for last year averaged $4,500, which was only about 10% of the previous cost. And so within a year, for each year, they're able to serve about 5 times more households than they were able to serve a year before that, to end their homelessness, and the larger impact of this program making this change. And I think the program had 16 households that they served at a time. And by making a complete change, family homelessness is decreasing in Richmond, and they've eliminated all waiting lists for shelter, which is just very significant, because they would, you know, because of the backup in the system, they would often have families waiting for shelter. So I think one of the things it's important to know is that retooling happens in stages, and so you know, you may not, you know, it took some time. I think with Flagler Home, it was about 1.5 years that it took, and so some of the things they did is they started by shortening the length of stay to a 3-month program and served those vulnerable at-risk populations. Those that they would have screened out before were the ones they were serving, and then, you know, it was complete. There was not all those other, you know, they used to have a family case manager. They basically changed all their positions, and they became just rapid rehousing positions. But one of the other things, you know, some communities have done is they've moved from facility-based transitional housing to transition-in-place models, where but that's more if you have a scattered site model and don't own your buildings. You know, when you're leasing scattered sites from the transitional housing, it's very easy to move to a transition-in-place model, which is really much more of a rapid rehousing model. And if you're considering doing this, we do have a retooling checklist on our website that can really help. It's actually 3 pages. This is just the first page. It sort of gives you a step-by-step process of the kinds of things that boards and staff of transitional housing programs can take a look at to move through the process. So in summary, I think it's really, important to really think about how are we really becoming a homeless response system, and what is our program doing to be part of this crisis response system. So, how are we adding to the work of retooling our response system to become a crisis response system that's preventing homelessness and rapidly returning people who experience homelessness to stable housing. In other words, how are we contributing to making homelessness rare, brief, and non-recurring in our community? And when we start to work as a system, it's really critical to evaluate every intervention in the system and each program within those interventions. And this, gives that guide, again, is this contributing to HEARTH objectives? Are we allocating our resources, to the most cost-effective strategies that have the best outcomes of ending homelessness quickly? And, just constantly be revisiting this, and as a system and programmatically, it just behooves all of us as program providers to really do a similar analysis of services. We recommend that Continuum, so this was developed for, a continuum to do as a system, but it really makes sense because a lot of you on the call are, work with an individual program. So as providers, really do an analysis of the services you offer and see how you measure up in moving your system towards preventing homelessness whenever possible, and rapidly rehousing each household if they do enter the shelter system as quickly as possible. So the question is, are you going to be a clock, a clock in a clock shop with all the other clocks in your community, and each intervention, each program, sort of does their own thing, or are you going to be one clock and a gear in that well-oiled clock that works together with all the other gears to create a system?